All right. Good afternoon, everyone. Looks like the number of people joining us has started to slow down. So I hope most of you guys have gotten settled in. Hope you can all hear me and see me okay. I'm excited to give this presentation. My name is Dr. Aleksander Hansen. I'm one of the first-year cardiology fellows here at Samaritan Cardiology. I'm going to give you guys a talk about some heart-healthy living. With that being said, this is me, Aleksander Hansen, first-year cardiology fellow. Little bit about myself. I was originally born in New York City at Lenox Hill on the Upper East Side of Manhattan. I don't really consider myself a true New Yorker. Only lived there for a few years. But at some point, I did end up in the Midwest and did spend a significant part of my life living there. I attended my undergrad at the University of Wisconsin-Eau Claire. It's kind of in the western part of the state, just east of Minneapolis, St. Paul. For those of you that have a bit more of an advanced geography in the Midwest. But while there, I did major in exercise science. And it was during that time I really developed a passion for cardiovascular system. So I'm very excited to be here with everyone today and kind of talk about how we can protect that, because it's important. But a little bit more, after finishing my undergrad, I did return to Norway, where I had lived for several years prior, worked in a psychiatric hospital. After getting some more experience in the medical field, returned to the U.S. I attended medical school at Rocky Vista University College of Osteopathic Medicine, just outside of Denver. I continued my westward journey. I matched into internal medicine residency here at Good Samaritan, and then I had the good fortune of being able to stay on and start my cardiovascular disease fellowship here, of which I'm about halfway through my first of 3 years. So kind of some topics that I'm hoping that we cover today. I'm hoping that we can answer these questions and you're going to be able to answer them by the end. So we're kind of going to be talking about what is heart disease, what leads to heart disease, and then what can you do about it to have a heart-healthy life. So first question, what is heart disease? Well, there's a lot of different forms of heart disease. It's part of the reasons that I have a 3-year fellowship, but there really is one most commonly thought of, and the one that we typically are referring to when we say heart disease, and that is atherosclerotic cardiovascular disease. And that is a complicated, it's a long, confusing word, but basically it's describing that there is a progressive narrowing and stiffening of the vessel, and there's many factors that cause eventual cholesterol buildup occurring in the wall of the artery. So again, breaking down the word atherosclerotic, athero meaning fatty deposits, sclerosis meaning vessel stiffening. It's incredibly common, unfortunately. It's a leading cause of death worldwide, and the US is no exception. It is the leading cause of death for men, women, and people of most ethnic and racial groups within the United States. About every 34 seconds, someone does die from a cardiovascular-related issue. And it's only getting worse. There's about 1 in 4 deaths that can be attributed to atherosclerotic cardiovascular disease. And unfortunately, we suspect that's only going to go up due to the epidemic of obesity, diabetes, and kind of worsening overall of the health of the average American. It's also expensive, over $2 billion in annual cost to our country. And this is for healthcare services, medications, and then loss of productivity with people missing work or being unable to work. And a lot of this is due to uncontrolled modifiable risk factors, which contribute to the worsening of atherosclerotic cardiovascular disease. So that right there should tell you that modifiable risk factors, we have the ability to, prevent some of this to a certain extent. We can, try to improve or prevent our risk of developing cardiovascular disease. And that's really going to be the focus of today's talk. When we talk about atherosclerotic cardiovascular disease, that's kind of the overarching umbrella term for vascular disease. And a lot of times, you can have this occur, essentially in any blood vessel within the body. I care about all of it, but the one that I get really focused about is when this occurs within the heart. And when that occurs, we use the term coronary artery disease. Your coronary artery is what we refer to the major arteries that sit on top of the heart on the outside and feed the heart muscle. Most people have three big ones that we really worry about and focus on, and then some people have some interesting anatomy where it might look a little different. And I think it's important that we remember that the heart is a muscle. It needs oxygen, it needs blood flow, and that occurs through these coronary arteries. And that progressive buildup of blockage and hardening that we're calling coronary artery disease can have potential significant ramifications. So just kind of another slide here talking about coronary artery disease. It's a pretty complex process. There's a lot of different factors that feed into it. But at the end of the day, these are kind of the four big things that feed into it. And you'll notice that this isn't really a linear process. It's not this happens, then this, then this. Any one of these can occur, start developing to the development of coronary artery disease, and it can just cycle from there. So, the cholesterol deposits can cause stress injury, leading to inflammation, so forth, and eventually leading to the development of coronary artery disease. And we can see over here on the left-hand side of the screen, this is a healthy, normal artery. And as we move from left to right, we can see that there is this fat cholesterol buildup occurring within the layers of the wall of the artery. And eventually it gets to the point where it starts squeezing on the lumen, and that can narrow the blood flow, which can cause some significant problems for people. So why does it matter? Why does it matter? When you're stressing the heart, like you would in exercise, the normal response for the artery is to dilate. This allows more blood flow to reach the muscles of the heart and delivers oxygen and allows it to do its job. But with progressive blockage in the arteries, you can potentially cause symptoms, meaning that the muscle on the other side of that blockage isn't getting what it needs. And that can lead to symptoms such as chest pain, shortness of breath, fatigue. And, this certainly can have more broader implications other than just having symptoms. The main then that we all worry about is a heart attack, otherwise called an MI. You might hear it called as a myocardial infarction. All the same thing. Heart attack is the term that most people tend to be familiar with. But essentially what we have here is that, as the artery can gradually worsen, this cholesterol that is within the artery that is compressing the opening has a very thin cap, and that ruptures for whatever reason. And you start having all this cholesterol and fat that was contained is now exposed to the blood. Your body recognizes that, and it starts forming a clot. And that's where the issues start, because that clot is going to start forming a total blockage of the artery. So then you suddenly have a very large portion of the muscles not getting the oxygen and blood that they need. And then we start having symptoms of chest pain. And usually, more oftentimes than not, you're going to end up seeing myself or one of my colleagues here at Samaritan if this is really the case. And, there's other implications. I really focus a lot on what happens within the arteries of the heart. That's my area of expertise. But in reality, that this process can occur in any artery, anywhere in the body. When it happens within the brain, we call it a stroke. It can happen in the leg, presenting with something like an acute limb ischemia or an occlusion, which is very serious. And it can also kind of gradually occur where you gradually, preventing less and less blood flow from getting to where it needs to. Sometimes it happens in the kidneys, and that can lead to worsening kidney function. But what contributes to heart disease? Well, it's a dangerous issue. We know it costs a lot, and it's a serious problem. So what can we do to impact it? Well, I think that, we need to know what are the risk factors before we can decide what we're going to do. So first one, smoking. Should not surprise anyone. We've been saying it for decades. Smoking is terrible. There are numerous negative health outcomes associated with it. Heart disease is one of them. Diabetes, obesity, high blood pressure, high cholesterol, family history, This is when you get a pass on. You can't really do anything about your family history, but it does play into your risk factor for having any heart disease. So what can you do? And that's going to be what we're focusing on today. What can you do as an individual with your healthcare provider to try to live a heart healthy life? So we're going to be talking about Life's Essential 8. Now these are kind of 8 pillars, if you will, 8 steps that are from the American Heart Association. They are designed to be simple for our patients, for our providers, so that we can all kind of have some good information, good discussion, and we all learn a little bit about what we can do to have a happier, healthier, and longer life. Now, as a former exercise science major, I think we're just going to jump in with the part that I love the most, and that's exercise. I don't know if it's said enough. I tell all my patients exercise is medicine. The benefits, especially within the cardiovascular system, that you get from exercise are tremendous. So we're going to talk a little bit about that today. You know, sometimes we tell our patients, you need to exercise. You know, great. You know, but I think the more information we can communicate, the better. So what do we mean by get exercise? Well, the recommendations as they stand are that people get about 150 minutes of moderate exercise a week. We're going to talk a little bit about moderate and what vigorous, you know, that's the other option. And then you only need 75 minutes a week. 150 or 75 minutes in the course of 7 days, it's not that much. You know, that is something that everyone has time for in the course of a week. And you know, it's not like you have to go out and do these big runs for 40 to 45 minutes at a time. There's some data that shows that, you know, doing this in intervals of 10 minutes or more can actually be very productive and carries benefit. And then just pointing out here this combination, you can do a combination of moderate and vigorous activity if you're feeling more motivated. But biggest thing, get out 150 minutes is kind of the number that I think most people find that they can remember. What is moderate or vigorous exercise? And how do you quantify that? Well, there's a lot of information out there on the internet and how we should measure whether or not exercise or your activity level is sufficient to be deemed, you know, exercise, and that being moderate or vigorous. Now, a lot of times you'll see this presented in the form of METs, and that stands for metabolic equivalent of task. And this essentially is a very scientific way to try and quantify how much energy relative to the mass of a person is needed to perform a physical feat. And that is really kind of a gross oversimplification of what it is, because basically, you know, these METs and what METs are required for a person to do exercise is going to vary for everyone. But they've done some data, and these are kind of the average METs that they see in people when they exercise. So, you know, when we're talking about moderate, we're looking to about 3 to 5.9 METs. That might be a brisk walk, biking, yoga, swimming. And then for those individuals interested in more of the vigorous exercise, we're looking at jogging, running, maybe you're biking a little bit faster, and some of the competitive sports like tennis, swimming. A few more activities and kind of their MET equivalent. Good news for those of you that like golfing, you can walk, it counts, that's exercise. Doesn't count if you ride the cart though. Hiking, weightlifting, other great ones. If we have any skiers here, that downhill, definitely you're looking more at that vigorous. So, you know, easily something that you can knock out with a day or two over at Bachelor if you have the chance. But it's not listed on here for anyone that likes cross-country skiing as well. That's an excellent form of exercise, and you're definitely going to hit your MET requirements, you know, that way as well. But I personally, I don't like talking about METs. I don't have this chart memorized. I don't think most of my patients have even heard of the term MET before, let alone have the chart memorized. So, you know, what are some other ways that we can communicate how hard you should be exercising to make sure that you're getting the benefit that you need? You know, I think exercise by heart rate is becoming increasingly popular with the rise of smartwatches and devices that allow you to measure your, you know, heart rate in real time. And there are a couple steps. We're kind of going to walk you guys through how you would want to do this at home, but also realize that this can easily be looked up on the internet, and you can do it that way as well. So first thing you need to do is try to determine what your age-predicted maximal heart rate is. This might be an equation that some people are familiar with, just taking 220 minus your age, and boom, that's your age-predicted max heart rate. That one works fine. It's easy to do. Most people are familiar with it, but it's probably not the most accurate formula in terms of trying to get your age-predicted maximal heart rate. This one looks a little bit more complicated, but promise you it's not too bad, especially with all of us having calculators now on our phone. But here we're just taking 206.9 and we're subtracting the the age times 0.67. And this is actually the recommendation from the American College of Sports Medicine that we use this equation for predicting our heart rate. Now, if we look over here at the chart in the top right corner, they're kind of giving us a percent of your max heart rate and how that can correlate to moderate and vigorous exercise. I will say that the heart rate ranges in terms of what falls into moderate or vigorous is not as well established as maybe the METs are, but I think that if you're in that 50 to 80% range, you can comfortably say you're exercising at a moderate intensity, and if you're above 80, you are truly at a vigorous intensity. So quick little example here. We have a 57-year-old who wants to do moderate exercise. We're going to use the simple formula, 220 minus their age, 57. That gives us an age-predicted max of 163 beats per minute. Now, I just said that moderate is probably between 50 and 80%. So we can do 163 times 0.5. That gives us about 82 beats per minute. And then times 0.8, the upper range of that gives us 130 beats per minute. So when this person's exercising, if they're able to check their heart rate, if they're in that 82 to 130 range, they're golden and they can feel comfortable, that they're exercising at a moderate intensity and getting the benefits that they need. And you can do the same for vigorous exercise. You're just changing, that percent that you're looking for. Now, what did you say? Dr. Hansen, the heart rate stuff looks complicated. I don't have an Apple Watch. I hate math. Or maybe, you're on a medication that can even prevent your heart rate from getting as high as you normally could. There's a lot of medications we use, especially in cardiology, where that is the intended effect of the medication. That's okay. This is probably the easiest way that we can talk about, making sure that we are exercising at the appropriate intensity. This is basically just a scale of how hard you're working. Now, when this was initially published back in '82, they did this scale on a scale of 6 to 20. That doesn't make a whole lot of sense to me. I can't ever keep track of what's what. So they came out with this modified Borg scale on the right here, scale of 0 to 10. Most of us are very familiar with this, and we don't really have an issue kind of putting ourselves in terms of how hard we're working. And there's good data that it's actually been studied, and they've correlated it with heart rate, that people that are exercising in that 4 to 6 range, it usually correlates to a heart rate that is representative of moderate exercise. And the same goes for those higher numbers. Once you get to 7 or more, you're in that vigorous exercise realm. So you can just do this when you're out for your walk. Just ask yourself, how hard am I working? Am I at a 4? Am I at a 5? Or maybe more. Maybe you're at a 2. You got to pick it up a little bit, and that's okay too. But this is a super easy way to make sure that we're exercising appropriately at the intensity that we want. This is just a chart that kind of puts it all together. You can see that your METs, 3 to 6 is where we still have that moderate. They use heart rate ranges that are a little bit different than the ones we discussed. But, a lot of information available out there in terms of trying to figure out how hard you want to quantify your exercise. So here's a great little chart. And this was they used pooled data from a lot of different studies. to examine the effect of exercise on people's risk of having cardiovascular disease and death. The first thing that I really want to point out here is that just even a little bit of exercise has a pretty dramatic benefit. It's the steepest part of the slope right here, with almost some of the very minimal exercise. So just getting out and doing a little bit is already going to carry quite a bit of benefit. When we look at where we get the 150, 300 minutes of exercise from, that's also some of this data where we see that most people, the most amount of benefit that you really get is kind of in that 150 to 300 minutes, or the bottom here is 10 to 15 MET hours per week. But if you're super motivated and you go beyond that, no worries. Just know that you're not getting a lot of benefit, more so than if you were to do a little bit less in that 150 to 300 minute range, but you're also not putting yourself at higher risk, which I think is important to point out. So this is one of the first cheat sheets that we're getting to. These are all available on the American Heart Association. They're all kind of condensed, abbreviated chunks of information that anyone can reference at any time. So kind of we're going to be going over these, kind of wrapping up each section of the different pillars of Life's Essential 8 that we talk about. So just a reminder, 150 minutes, 75 minutes of exercise if you're doing vigorous. Try to include some strengthening activity as well, like resistance weight training. Even some yoga is good as well. And sit less. I think that we're going to see how bad sitting truly is. There's some people in the exercise research realm that are kind of referring to sitting as the new smoking. So get up and move every hour. Kind of at the bottom here, I'm sorry. I don't really treat kids or teens, but they should actually be getting 60 minutes of exercise every day. The epidemic of obesity and diabetes is already starting in kids. And again, it's expected to also worsen. So we need to get our kids out and moving as well, 60 minutes every day. All right, so moving on, we're going to be talking about cholesterol and how you can control your cholesterol. I think that a good place to start is, what is cholesterol? It is a class of molecules in the body that have a variety of functions, and they are essential to life. They are part of the walls of the cells in our bodies. They are incorporated into hormones that help our body function. They're even part of the skin. But imbalance of cholesterol can certainly lead to heart disease. The body primarily makes its own cholesterol, but it can also absorb cholesterol from food. And they are carried in the blood by these molecules called lipoproteins. Now, this is maybe some of the cholesterol that you are all familiar with. The first one we have is our high-density lipoprotein, HDL. This is our good cholesterol. It takes cholesterol that's in the arteries away from them and back to the liver for them to be disposed of. LDL, this is a low-density lipoprotein. This is the bad cholesterol, and this carries cholesterol out into the body to the arteries. And if there's too much of it and it's not getting cleared, it can cause some problems and inflammation. So how do we control cholesterol? Diet is super important. We want to avoid those saturated fats and eat fiber. Saturated fats are the fats that typically come from animal products, be they red meats, butter, and dairy products as well. And then fiber, we do know, can also improve your good cholesterol and lower your bad cholesterol. But the thing is that, we don't know what your cholesterol is unless you have it checked. So it's important to have it checked, and at least so we have a baseline and we can help make sure we get you sorted, whether it's too low, too high, and what we can do about it. And sometimes, medications are needed. Sometimes diet, exercise aren't enough. There's a couple people that draw a short straw and they have a genetic or familial component, which means that regardless of all the right things that they may do, their cholesterol still is going to be high. And, this is where statins come in. I assume that most of you at least have heard of them. They seems to be a lot of pushback from people. I think you might say that statins have sometimes gotten a bit of a bad rap. Here to push back against that a little bit. It's one of cardiology's most well-studied drugs. We have large amounts of data involving thousands and thousands of patients' years. And the thing is we know they work. It is the most effective drug in cardiology for preventing poor outcomes associated with cardiovascular disease. We know that they can reduce cardiovascular disease events by up to 55%. And because they've been around for decades, we've studied them. Now, I'm not going to tell you that there are not any side effects. There are. But to what extent those side effects are present is a little bit questionable. The biggest side effect that we tend to hear about the most from patients is symptoms involving muscle cramps, fatigue. And right now, the literature says that occurs in about 3% of people taking this medication. And they've done some studies where they've kind of, people have felt that 3% is a little high. And they've actually done some studies where they have put people on a statin, and they tell them they're on the statin, and then they take individuals who are blinded, and they don't know if they're getting a statin or a sugar pill, if you will. But then they compare the people that know they're on a statin to those who don't know they're on a statin, and they actually see that the people who know they're on a statin report higher incidences of side effects compared to those people other people who are on a statin, they just don't know it. So, really trying to determine the true prevalence of these muscle symptoms and side effects of this medication is a little more challenging than maybe it would first appear. But that being said, it's a safe medication and it's very, very effective. So, just wrapping it up here, I think that if we understand that cholesterol can come from our body and come from our food, meaning that we need to watch our diet, and we're going to be talking about that in a little bit here as well. Remember, the HDL is the good cholesterol and the LDL is the bad cholesterol, and then see your provider to get it checked if you haven't had it checked recently, because if we don't know it's bad, we can't treat it. Also, reoccurring theme here, you're going to see this with a lot of these Life's Essential 8, is there is overlap here. So move more, and we're going to be talking about some of these other tips for success here as we move through the presentation. Segueing in, we're going to be talking about diet. And I think diet often seems like, oh yeah, I should eat better. And people, will say they try, but it's actually kind of difficult to put into practice. And with the internet, there seems to be an overwhelming amount of data about which diet is best. Should you do keto? Do you want to do plant-based, carnivore? And you can probably find a study that supports whatever diet it is that you're looking at. But here's the thing, diet studies are hard to do. There are an endless amount of variables that people have to try to account for, and most of the time they aren't able to. And you need a lot of time. You can't do a diet study over a year, 5 years even. You really almost need a lifetime of data to find out if this diet is truly beneficial. And the other thing is that most diets are going to look good if you compare it to the average American diet, because the average American diet is quite poor. So, all that being said, what diet do we recommend? Well, I don't think anyone is really going to be too surprised here, but Mediterranean diet. That is the #1 diet, the heart-healthy diet. And if you end up seeing a cardiologist, and I wager most of your primary care physicians as well, this is the one that we recommend. It's the one we have the best data for. So, they have found that people living in the Mediterranean, Greece, Italy, Tunisia, they have less heart disease. And one of the overriding, common themes there is, diet. They have a diet that is largely plant-focused foods, whole grains, vegetables, beans, fruits, nuts. The primary fat is olive oil rather than butter, red meat like we may have in the US here. when they do eat, animal protein, it's in moderation, and typically it's a leaner protein with fish, seafood, poultry. And then red meat and sweets are really only eaten on occasion. So we just have a couple examples here of some healthy options. So you can see the lean meat here. It looks like some chicken, a lot of greens, maybe some whole grains over here as well. And then you'll notice that the plate is predominantly vegetables. Here's another option. No animal protein here. Looks like we got some olives. Again, lots of vegetables. Looks like we got some chickpeas, avocados, representing that good fat that we want to try to get. Very colorful plate here again. Lots of fruits and veggies. Nice salad here. And again, maybe some type of grain bowl. And again, last one here, focus on the lean animal protein with looks like a chicken breast. And this is another diagram that some of y'all may be familiar with. And it's kind of just a good way to visualize, how much of your plate should be taken by the different type of food groups, if you will. So about half your plate should be fruits and veggies, and there should be a good variety there as well. I will point out, sadly, potatoes, French fries do not count as a vegetable. They're rather nutritionally poor. So when we think veggies, I want you to think green beans, Brussels sprouts, cabbage, that sort of thing, not potatoes. On the other side of the plate, getting some whole grains. You're trying to limit, processed white bread. You're looking at whole grain pasta, brown rice, and then of course the healthy protein with fish, beans, nuts, and limiting really red meat and cheese, and then avoiding bacon, cold cuts, and other processed meats. So in summary, how to eat better. Starts with a healthy eating pattern, smart choices, getting lean protein, getting lots of fruits and vegetables. That should be most of your plate. And then limiting all the, sweets, alcohol, as much as you can. Everything's okay in small amounts, but really want to minimize as much of that as you can. Cook at home. Much easier to watch what you're eating when you're cooking at home. So try to do that as much as possible. If you're needing some inspiration, I will say that the American Heart Association has a lot of heart-healthy recipes on their website. They're quite easy to follow, and I think most of them do turn out quite good as well. Also, try and familiarize yourself with reading some nutrition labels. You don't have to, have a complete understanding of everything that's on the back of it, but I think if you can at least appreciate what the serving sizes are, how much fat, and maybe how much sodium is in it, I think that's a good place to start. Some other resources, you can look into My Plate. That was kind of similar to that plate diagram that we just reviewed. And then there's also this DASH diet. That stands for Dietary Approaches to Stopping Hypertension, which is high blood pressure. And in a simplified way, this is basically the Mediterranean diet with a sodium restriction. So with this diet, they're showing that you should really be having 2,300 milligrams of sodium a day or less. So that's 2.3 grams of sodium. If you measure that out at home, maybe you think that's not that much sodium. There's no way I'm getting that in the course of a day. And maybe that's true, but the problem is that where salt sneaks in. So when I'm talking to my patients in clinic, I'm always asking them about their diet. And one of the big questions I ask is how much of your food comes from canned or processed foods. There's a lot of food out there, canned vegetables, for example, where, you wouldn't really expect them to have a lot of sodium, but it's there and it's kind of this big salt bomb and can sneak up on you. So again, getting good at reading the nutrition labels. So kind of, in summary here, closing it out again, lots of fruits and veggies, limit your sugary drinks and alcohol, avoid the processed foods, plant-based diet. Now, I'm not saying you need to be vegan or vegetarian, but primarily plant-based is what's going to carry the most benefit in conveying protection for cardiovascular disease. So managing high blood pressure. So what does that mean? You come into the doctor and we're like, it's X over Y. What does that mean? Well, there's two numbers that we really talk about when we are talking about blood pressure. The first number is the systolic blood pressure. So that's the top number, and it measures the pressure in the arteries when the heart squeezes. The bottom number is called the diastolic, and that measures the pressure in the artery when the heart is relaxing, so in between beats. And, you know, this is kind of the heart rate ranges that we're looking for. Really, you know, under 130 over 80 is what we're hoping for, ideally less than 120 over 80. Now, some of you might remember that it used to be 140 over 90. That's the old recommendation, and we've had, you know, changes in the guidelines in more recent years that said that even tighter blood pressure control is important in trying to prevent things like heart attack and stroke. Now, how do you control your blood pressure? Well, you know, first thing we got to check it and find out what it is. So check it, and we can make some changes as well. So a lot of the things we've already talked about, exercise, diet can have a profound impact on your blood pressure. And then control it. Sometimes you can be done with lifestyle modifications like exercise, diet, weight loss, and sometimes, you know, got to have some medications on board to, you know, get you where you need to be. And that's really where your primary care team comes into play in helping make sure that's the case. And here's some ways to check your blood pressure. I'm sure most people have seen this big machine at certain grocery stores, pharmacies, and that's fine. You know, these are some of the monitors you can have at home. Both of these are fairly simple, straightforward. Out of the two, I definitely prefer the monitor that goes up on the arm above the elbow. I find it to be more reliable and give us accurate numbers. But if you already have the wrist one and that seems to be working for you, that's acceptable as well. I think these are somewhere, I don't know, 25, 40 some dollars on Amazon. Don't quote me on that. But, you know, if it's a concern, I certainly would encourage most people to at least monitor what their blood pressure is doing. You know, if you are diagnosed already with blood pressure, you should be keeping track of it. That's what I tell all my patients. How you do so, that's up to you. I think that a chart like this is a great way. It's got columns for date, time, you know, what the different readings were, heart rate, and then maybe a comment, you know, oh, you're very stressed, you just got done exercising, or you're feeling unwell, maybe you're dizzy. And you can kind of write that in there, and you can bring this to your doctor, and it gives us a lot of good information. And, you know, we can kind of see what your blood pressure is actually doing when you're in kind of more your relaxed environment at home, rather than just going off what we see when you come into clinic. You're stressed, you're running late maybe, and we've just rushed you back to the exam room. We check your blood pressure, and it's elevated. You know, so definitely seeing what it is outside the clinic can be very helpful for us. So what can you do to prevent or treat hypertension? Well, there's a lot of factors that go into it. But again, diet, weight loss, watching your salt, being physically active, and then moderation in alcohol in addition to medications. Now, we've got some great data that says, you know, diet, weight loss, exercise, you know, those can drop your blood pressure on average, 5 to 10 points each. And that's pretty profound if you've got an elevated blood pressure. So, you know, again, coming back to it, exercise is medicine, and then combining that with making positive choices for your diet, and you can really have a profound impact on your blood pressure. And if you need a little help, we certainly have a lot of medications available that are usually well tolerated in terms of, you know, helping people's blood pressure get under control. So just wrapping up again, top number, your systolic, we want that less than 120, and that's the pressure that happens when the heart squeezes. The bottom number, the diastolic, that's the pressure when the heart's relaxed in between heartbeats. We want that less than 80. So once again, watch your diet, make good choices, watch your sodium, get out there, move, get your exercise, and then, you know, making overall good, healthy lifestyle choices. And if you do have concerns, talk to your primary care provider. All right, so we're going to talk a little bit about weight loss. You know, I think weight loss is certainly a problem that many of us deal with. And out of all the things that we have discussed so far today, it may be the most difficult in terms of trying to make a positive impact because, as you know, weight loss can be quite difficult to achieve. Coming up with a healthy weight is very individualized. And so being able to say, oh, the average, 60-some-year-old female should be this weight, that doesn't really work. A lot of times we talk about ranges, specifically with BMI. That stands for body mass index. And that basically is your kilograms, so weight in kilograms divided by meters squared. And this works well for when you're trying to study a large amount of people, doing populational studies, but it's not super great on an individual level. It doesn't really differentiate between weight that is a result of fat mass versus muscle mass. So, we might see some of these big football players at OSU, and by their BMI, they would be obese, even though they are just jacked, and it's kind of an imperfect measure in that sense. We also focus a lot on what a waist circumference is, or what the goal should be. For men, less than 40 inches around, less than 35 for women. The reason that we think this is important is that fat that gets localized to the abdomen or the waist, we know that increases our risk for cardiovascular disease. And even a small amount of weight can actually have a weight loss can actually have a pretty profound impact on other risk factors. So small amount of weight, in addition to not only helping you feel better and move easier, it's going to help your blood pressure, your cholesterol, and your diabetes. So I don't really want people to think that you have to lose a ton of weight before you're going to start seeing a benefit. It's kind of like exercise. You're going to start seeing pretty dramatic benefit very early on in the weight loss journey. And I think that hopefully I'm not stealing anyone's thunder by addressing this now, but there's a lot of talk online in the news media about these new medications that can help with weight loss, and they do. They actually can lead to dramatic weight loss, but they should not be used in isolation. Those medicines should be used in people who are active, they're exercising, they're making right choices with their diet, because otherwise you're not really going to see the full benefit of just weight loss if you continue to eat poorly and you're sedentary. So, wrapping up, it's all about calories again, calories in versus calories out. I think that they've kind of shifted away from this mindset that you need to count every single calorie you're in to much more of a passive view, and kind of have a general sense of how much calories are you getting throughout the day. And I think it's worth pointing out that you really got to focus on your dietary choices, and you can undo calories burned in a whole workout by making the wrong choice and having a donut. So just be vigilant, but don't necessarily obsess about it, is how I would kind of phrase it. So this is the newest addition to kind of these pillars of health that the American Heart Association has added. It used to be simple seven, and I think in the last year or so they added sleep. And sleep is super important. I think probably in more recent years, decade, we've really begun to appreciate how important sleep is and how much poor sleep negatively impacts you. We know that poor sleep increases your risk of cardiovascular disease, cognitive issues such as dementia, high blood pressure, obesity, diabetes, and kind of at the bottom here, it's not only just duration. So are you getting long enough sleep, but is that quality of sleep good enough too? 9 hours of poor quality sleep is not the same as 9 hours of good quality restful sleep. And just something tying into sleep here, we'll talk a little bit about obstructive sleep apnea. It's a very common problem, unfortunately, and it's exactly what it sounds like. The upper airway gets occluded by tissue. There's a lot of risk factors for this. Some of the more common ones include obesity, having a thicker neck, And there's kind of some other ones that we focus on as well. And we know that obstructive sleep apnea, especially if it's not controlled, can lead to higher blood pressure, heart disease, and a lot of the other risk factors we just talked about on the last slide. And trying to find out if someone has obstructive sleep apnea is, quite easy in terms of screening. And we look at this stop bang questionnaire. And a lot of times it's answered by someone's partner because they know that their partner is snoring. They wake up at night and maybe you feel tired. So those are certainly kind of questions that you can kind of ask yourself if you think that there may be a risk for sleep apnea. Sleep hygiene, getting a good night's sleep starts before going to bed. That means, we're not drinking caffeine late, we're not exercising really hard before we get in bed, we're limiting alcohol, and we're not having heavy food immediately before getting into bed. Try to have a routine, try to get up and go to bed at the same time every night. Realize that can be difficult. Go for some light exercise in the evening if you have the time, and try to keep that room cool and dark. But realize that setting yourself up for success for a good night's sleep actually starts well before getting into bed. So again, just kind of review, a lot of benefits from getting good night's sleep, and a lot of negative ramifications can happen from poor sleep. All right, so let's talk about reducing blood sugar. We naturally have blood sugar at all times. It is the main source of energy within the body, and there's kind of a range that our body is happiest at. Low blood sugar can be dangerous. Not something we run in too often. Tend to see people who have type 1 diabetes or those on insulin therapy. And low blood sugar is dangerous for a very different reason than high blood sugar. And when we talk about high blood sugar, really the risks come from long-term exposure of having high blood sugar. This can lead to inflammation within the body and can predispose you to a significant number of health issues, including cardiovascular disease. And chronically high blood sugar is really kind of what we define as diabetes. And there are some long-term complications of persistently high blood sugars or uncontrolled diabetes. It can really damage the arteries everywhere in the body, and not just the big ones as well. It can impact the very small arteries, what we call microvascular disease. This can cause, damage to the kidneys, worsening kidney function. It can cause nerve issues as it wears down the nerves, and it can cause eye problems as well as it causes issues with the blood vessels in the eye. So it is serious, and we try to work very hard with our patients to try to make sure that their diabetes is well controlled and at goal. So how can you do that? Maybe I'm sounding a little bit like a broken record at this point, but we're limiting sugary foods and drinks. And sugary foods, it's not just sweets, candies, it's white bread, white rice, anything that can be broken down very quickly into glucose and causing that spike. And a lot of that comes from carbs as well. Exercise is super important. The more we exercise, the more we're using those muscles, the more sugar they're going to want to take in to operate properly. Quit smoking and, see your doctor. Again, this is one of those things you may not really realize is an issue until, you have it checked by your physician. And this is just a little slide showing kind of, incidence diabetes, and how it is impacted by not doing anything. Placebo up here on top. Metformin, which is a very common medication that we use. It's probably the first medication we use to treat most of our patients with diabetes. And then lifestyle modifications. And look at that. That is pretty significant. Even when comparing the metformin to lifestyle, you get a very large benefit from having lifestyle rather than just metformin alone. Again, highlighting the importance of positive lifestyle changes like exercise, watching your diet, weight loss. And again, talking a little bit, if there's concern, this is a chronic issue. Having higher blood sugar immediately after a meal is expected, not really a concern if it comes down, but having it be persistently elevated in the long term is what gets us in trouble. All right, so I think this is the last of the 8 pillars that we have, and this is tobacco. And it's terrible. I think I might have already mentioned it, but it's bad. There is no safe level of smoking. Even one cigarette a day can have profound negative implications with regard to heart disease. And smoking a pack a day, it's going to double your risk of having a heart attack. And the recommendation is that you stop and avoid secondhand smoke as much as possible. And this is actually one of the leading causes of preventable death in the U.S. Now, when we talk about tobacco use, primarily what we're focused on is, traditional tobacco, cigarettes. I don't necessarily think that chewing tobacco or tobacco alternatives are any healthier, and they're all terrible and they should be avoided. But really, in terms of heart disease, we focus on the inhaled tobacco, like cigarettes. Also, in the newer guidelines, it's avoiding vapes, nicotine pens. They're just as bad. They're not a healthier alternatives. They need to be stopped as well. So what can we do about it? Well, I think the big thing is that the individual who needs to quit needs to want to quit. Doesn't matter how much we tell them, but if they're not ready to do it, they're not going to be successful. So we try to motivate them. We educate people. We tell them all the bad things that'll happen if they keep smoking, and we try to get them to the realization that they need to do this for themselves. So once we have that person ready to quit, that's where the plan comes in. And they're highlighting here kind of ways to go about this. You got to pick a date. Don't linger and say, oh, maybe I'll do it in the next week or so. Pick a date. Next Sunday, that's my quit date. Choose how you want to do it. You want to go cold turkey? Do you want to use nicotine patches, gum, lozenges? And then decide, do you need your healthcare professional to be involved, especially if you're going to use some more of the other medication options that we have. And then get ready. Talk to your doctor. Realize that you're going to have cravings. It's going to be difficult, but you need to have a plan in place on how you're going to deal with those things. And then when the quit date comes, you quit. And then you take it one day at a time. So kind of towards wrapping up here, how can I live a heart healthy life? Well, you eat better, talk about the diet. Mediterranean diet's the way to go. More active. 150 minutes of moderate exercise a week or 75 minutes of vigorous exercise. Manage your blood sugar. Again, exercise, smart diet choices. Manage your weight. Exercise and smart diet choices. Cholesterol, blood pressure, quit smoking, and get some good sleep. And if you have any concerns, you feel like you need more information, or even just want to get checked, whether that be for diabetes, cholesterol, talk to your primary care provider. So what can you do today? Start walking. You don't need to run a marathon. Start slow, but be consistent and gradually build on your exercise. Eat like the Mediterraneans, quit smoking, set a date, let people know so they can hold you accountable. Consider getting a blood pressure cuff, and set an appointment with your primary care provider if it's been a little bit. And then, of course, try to get some healthy sleep as much as you can, and remember that starts before even going to bed. So with all that, happy to take any questions, and we will just go from there. Ram, looks like you have a question.
Yes. Is there any kind of a scale of like 1 to 10 or a percentage that can be determined about the amount of atherosclerosis someone has?
So I think looks like you're kind of asking about maybe doing like a screening test is kind of how I would interpret that question.
Yes.
And in terms of determining the presence of atherosclerotic disease, the best test that we have is really an invasive test with a coronary angiogram. And we really do try to reserve that for people that have symptoms and we have very strong suspicions. There are some stress tests that people get as well, but again reserved for people that have symptoms or maybe some suspicion. There is some newer data that's coming out in terms of doing coronary CT scans where we look at how much calcium is built up, and maybe that tying in to the risk of cardiovascular disease risk as well. But there is no simple test that can be done in the clinic to try to determine the presence of cardiovascular disease in an individual.
Okay, thank you.
Absolutely. Now, so the question is, can you recommend a reference for multivariate analysis or meta-analysis of ASCVD risk factors, or a referral for a PhD in cardiology in Oregon or elsewhere? So I think what Tommy's looking for here is a study where we can look at all the risk factors that we collect from large pools of data, and kind of use them to determine the atherosclerotic cardiovascular risk factor. I think I'm interpreting that question correctly there. But the short answer is I do not have that journal article or study off the top of my head. So I apologize, I'm not really able to get any more information on that.
If you already have damage to your coronary vessels, can you improve them or can you only maintain them? Where
there is some data that exists on how to reverse coronary artery disease. It's pretty extensive in terms of the lifestyle modifications, the amount of exercise you need on a weekly basis. And it is quite difficult to be able to hit those goals and actually reverse the development of coronary artery disease. So typically what we talk about is just trying to maintain it where it is and then reduce all the risk factors to try to prevent it from progressing. And again, that's where we talk about medications, exercise, diet.
Okay, thank you.
Yes, sir. Linda, do you have a question?
Yes. How long after you have quit smoking does it benefit your heart health?
I would say, so the number that we tend to throw around, I mean, you're going to get benefit relatively quickly, but 1 year after you've quit smoking, your risk of heart attack has already been cut in half by 50%. So within a year, you've already cut your risk of a heart attack happening by 50%. I mean, that risk continues to drop the farther we move out from your quit date.
Even if you've been a chronic smoker for 20 years?
Yep. So, the risk does go up the longer you smoke. So, it's going to take you a while to get back down. But yeah, that risk is about cut in half after your first year.
Well, I'm proud to say I am smoke-free since August 1st of last year. So I feel I've made a big step in this.
Absolutely. That is awesome. Congratulations. Keep it up.
Thank you.
Okay, well, thank you. Barring any more questions, I think we will let Dr. Hansen get back to his patients today. Thank you so much, everybody, for coming. And a recording will be available, I believe, within a few days.
Thank you, everyone. Appreciate everyone's attention and questions.
Thank you. Very informative.
All right. Take care, everyone.